Magnolia State Family Medicine, Health Center and Medical Spa, 1009B City Avenue North, Ripley, 587-8176. Call for your appointment. Providing modern medicine with Southern hospitality. That's Magnolia State Family Medicine, 100% veteran-owned and operated. Bethel University Physician Assistant Program affiliated. Magnolia State Family Medicine. Dr. Christopher J. M. Cummins, Medical Doctor. Fast, hot, and fresh. Open 24 hours just for you. Dodge's Store. Come be our guest. Dodge's Store, Ripley. We are 100% employee owned with friendly service and a fun atmosphere. High quality, low prices. We are Food Giant. Our deli serving breakfast, lunch, supper. Food Giant, 702 Highway 15 North, Ripley. Come shop Food Giant. Want fresh meat and fresh produce? Food Giant's the place. High quality, low prices. Food Giant.
Good evening. And Tony, you're going to have to come out here to adjust the camera for us a little bit. Lee Allen Pigram along with Dr. Cummins. This is a Ask Dr. Cummins show. And we'll get our better part of this show on in just a minute. We'll get the worst part off and get center stage. How you doing this afternoon, Doc?
I'm doing well in this balmy
afternoon. Isn't it? This is kind of unusual in November. Kind of enjoyable, though. Short sleeves. I got a sweater on. I get cold-natured, I guess, or whatever you want to call it. Anyway, the phone number is 587-8176. Give it a call. Ask your questions. No, not too big, too small. Privacy guaranteed. And if you come up with some questions, please give that number, 587-8176, a call. And ask Dr. Cummins. That's what this show's about. It airs on Thursday nights at 6:30. From 6:30 to 7, and we'll get right into it, Doc. I've got a lot of things that people are hitting me with. One of the main, this is not necessarily a medical question. This is a facility question. I'll read it like it was asked to me. Any way to possibly get a kidney dialysis center at the Ripley Hospital or your office? There's about 100 patients that need dialysis locally. Now, this came up, the owner of the TV station has got, he has to have dialysis, okay? And I was talking with him this afternoon. He does it at home 5 times a week. They ship him the supplies. He says he's looked at the bill and it runs about anywhere from $40,000 to $50,000 a month for the stuff that he goes with. And somehow there's been a problem, so now he's gonna have to go back and go to Corinth. And I believe he has to go to Corinth 3 times a week. And he was wondering, he says, you know, it's just a room with the stuff to do but I've got the same type of stuff here at my house. Why couldn't somebody locally, like a doctor's office in Ripley or the hospital in Ripley, he says, I got friends that have this. There's a lot of people out there. Why couldn't we get somebody locally to administer this? Because all I do is go down there. I've been doing the same thing, he's saying, I've been doing the same thing for 2 years myself. So it's not really a highly trained other than, you know, well, he didn't mean it that way, but he just meant if I can do it, it seems like we could get a nurse to do it. Right. And save us from having to go to Tupelo or having to go to Memphis or having to go to Corinth. And his question is, what's the possibility of that ever happening for Ripley? Maybe at the hospital or your office?
Right. I think it's a real good and thoughtful question, and that has come up in conversation over the last year or so. And at one point, I thought one was going to be in the county, but apparently it has not materialized. And he has prompted me. I will dig back into this because I would certainly entertain the idea of helping facilitate this, and I think that would be a real big feather in the hat of whoever could do it in the county.
Yeah. I don't guess his question was not seeing a doctor. You know, everybody, right. You got a specialist, okay, we all know that. But his question is, this is something that if I'm handling it in my house, somebody ought to be able to handle it in their office to keep me or anybody else like me. If I can handle it in my house and I go and have to go to Corinth, there's really nothing specially done different in Corinth than what I do in my house. It's just a different kind of medicine.
Right.
Now, he had the names for the hemodis and
Right.
all those big names.
I just tell them to stay tuned and check up with me. I'm going to follow up on this in the next week or so and see what we can do.
Medicare sure pays for it, and I think he told me right. I believe I'm correct when he said it was $40,000 to $50,000 a month on the. He gets these big UPS shipments of boxes upon boxes of the stuff, the fluid that takes it. That I guess it's an exchange, isn't that what they call it?
Right.
Okay. Well,
that's very interesting. That's a wonderful
that's one
idea.
out of the way. All right, I got one here now, and this is from an elderly lady. She took a test for bone density, okay, and it is not good. She didn't get a good report. Now, I didn't get what the readings were. I wouldn't understand it. She told me. She has to take a shot once a year and supplements. Is she headed, her question is she headed for a hip or knee replacement? And is there any chance to avoid that if that's where she's headed?
Right, and that's a good question. And if it's a once a year infusion, we offer those in my clinic. They're called reclassed, and it's a once a year IV infusion. Takes about 15 to 20 minutes, as opposed to taking a pill every day. And if you take the pill every day, you have to be in a certain position. You can't eat food for so many hours in between, all this kind of stuff. So that's a new thing that we've started doing is infusion in the clinic. Osteoporosis, certainly if you have that diagnosis, it makes you a lot more susceptible or more likely to have a hip to break or fracture if you fall on it, okay? Also opens you up to the compression fractures in your spine and things like that, and that's just the weight of the body bearing down on that spine. The idea and the thought or the theory behind stuff like reclassed and other things for medicines for people with osteoporosis is that if you increase the bone density or the mineralization of the spine, you protect that bone, make it stronger, so when you do fall, you decrease your fracture risk. So she's doing the right things, but you are wasting your time if you're taking all that medicine and you're not taking the calcium supplements with vitamin D. Sounds like she's doing that.
Yeah, I didn't put that down, but that was in the.
Yep.
I left that off. The vitamin D.
Yep.
She mentioned iron and vitamin D.
Right. That's great. So she's on the right track. She certainly needs to have her. If she has osteoporosis, which is the full disease, the full demineralization of the bone, she needs to have that rechecked every year. The DEXA scan, the bone scan, and we do have that at the hospital available.
Available at Ripley's.
Yes,
Hospital.
sir. And the other thing, if you have a lesser degree of that disease called osteopenia, which is kind of like pre-osteoporosis, you do that bone density scan about every other year. And certainly, again, calcium with vitamin D. Some insurance companies go ahead and cover you for medicines for that as well. You just need to talk to your provider, your doctor about that.
Is the medicine different for the osteopenia as the osteoporosis?
Well, like for example, with the osteoporosis, you take the reclassed IV treatment once a year. If you have osteopenia, you take IV reclassed every other year.
Okay, so it's not as often.
You're just not as aggressive with that treatment.
Well, and then she said, is she headed? Is it an automatic, I guess a better way to ask it, is it an automatic given that she's going to have down the road these type of things, a hip replacement, a knee replacement?
Now, it just depends if she falls, and you
well, of course, that could happen when you got osteoporosis.
That's
or
right.
not.
And but if you have osteoporosis diagnosis, your likelihood of a fracture is greater.
Much greater, I'm sure.
Yeah, it's higher. But the big thing she can do, along with all she's doing, is to walk, exercise, stay flexible, increase her muscle strength, and eating right. It helps all that. So it's your whole body that we're talking about. We're not just talking about one specific thing, because everything is a big circle.
Yeah, well, young lady, I hope that answered your question. That was a good question.
Let us know.
That was a good question.
It is real good.
Got another question from a grandmother who had a grandchild that died from SIDS, SIDS, in 1989. On the death certificate, they put SIDS, but also stated that the 2-month-old forgot to breathe. That was on the death certificate. Is that the definition of SIDS? They forget to breathe.
No, I wouldn't say that. Sudden infant death syndrome is a syndrome. It's not a disease. And it's a syndrome is something that we do not know exactly why it happens. But in all likelihood, something happens that causes that child or that baby not to get all of its oxygen that it needs, and then it does die. There's all kind of thoughts about what causes SIDS. Secondhand smoke, putting the baby on the stomach and not on its back. All of those things probably do have a component in sudden infant death syndrome. But for just forgetting to breathe, it's probably not really what causes sudden infant death syndrome.
That's more broad than it is long.
Yeah, it's almost like SIDS causes the baby not to breathe, not breathing causes SIDS.
Right.
And it's a big problem out there, and there's all kind of apnea or oxygen monitors for children, but things even from it happens to older people sometimes, like a mucus plug breaks loose in the lung, and if it obstructs where your airflow, you could.
I don't necessarily see, and I don't know nothing about it, and I ain't trying to play doctor, but how do you diagnose SIDS? You don't.
No, it's basically
it's after the fact.
Yeah, it's a default.
Okay.
Like it's sometimes what we call, and I don't mean this in a negative way, but it's called a wastebasket diagnosis. Because it's basically after you have ruled out all of the things that you can say, Eureka, this was something that caused this problem. That would be something. It's like, well, it's sudden infant death syndrome because it cannot be explained.
Right.
Baby was healthy, everything was fine,
rocking right along,
and it just suddenly died.
And that's pretty. That happens a lot.
It does happen.
That's not isolated.
No, and it's a tragic event, and my heart certainly goes out to those people that have experienced that.
Okay, I hope that answered your question, young lady. Let me get one on my let me talk about my grandson just a minute. I'm going to ask this one. I've got a 15-year-old grandson. He lifts weights. He's very athletic. He does all the exercises on the foot. He's 6'2", weighs about 230. He gets something that my wife calls stretch marks. Now, I'm talking about they'll be like somebody scratched them, and it's scarred over where they scratched. And he's got that all over his body. What is the cause, or could be the cause of that?
Well, some people certainly scar easier, or do not, or when they do scar, they don't heal as well. And
well, he's not. These things are not caused from being scratched or caused from being. They just pop up. They appear.
Right.
In other words, and then there's the result.
Right. Weightlifter stretch marks, and it does happen to many people, but some people are just more. Their genetics allow that to happen more easily than other people's. But what they are is when your muscle mass grows faster than your skin can stretch to accommodate it. Okay?
I got you. Yeah.
And
he was, let's see, he's 15 now. When he was 11, let's say between 10 and 11, he just ballooned. I'm talking about overnight. He jumped up from being about, let's say, 5'6" to right at a little over 6 feet tall. It was like Gulliver's.
right, just a super fast growth.
Yeah, he
spurt.
just zoom, and he's up there.
Right.
He got so much bigger over a summer, and it started then, but now that he's these football players, they get into these year-long programs lifting weights and working out and all this strenuous exercise and everything. So you're thinking that maybe that type of growth that quick, along with his current regime of bodybuilding, is doing that.
Yeah, and there's a lot of debate.
But it is strange why they, you know, you can look at his shoulder and it looks like he's got 4 right there. Right. You can look at his side and looks like he's got 3 right there. And it's just, it looks like scarred up stretch marks.
Yeah, and we have creams and machines that we use to treat that. And the reason why
so you can treat that.
Oh yeah, and some of the ladies, the reason why they are more familiar with that because when they get pregnant, sometimes they have that faster growth too, and they get that problem as well. So stretch marks can come from not just lifting weights, but having a baby or just gaining too much weight too fast.
Yeah.
And but yeah, there's treatments that one can do for that.
Okay, that's why I was asking. I didn't know what to do for it. My wife started. He got a crop of new ones over this last football season. It seemed like he got about 6 to 8 more, and she's pushed the panic button, so she's wanting to know what to do. So we need to get him.
Yeah, we could look at him and see.
Okay.
And it can always even go the gambit of plastic surgery if they're too severe. But
well, they're pretty. I'm talking about they look like a full-fledged. It looks like one had been cut and got 8 stitches, and then there's the scar, and that's what it looks like. It looks like a full-blown scar. And it don't look like a.
There's a big debate of whether, you know, how young these people need to start lifting weights and how aggressive they need to do it, because you can damage your muscles and your body for life if it's not a controlled regimen.
Well, I've been very concerned about that. Yeah. This boy, he just took off when he was around 10 years old. Bam! I mean, it was just like he was. Show me the boy, and now here's the man overnight, and he had a full-grown man's body. And when he was 11, 12 years old.
And like with those young kids that hit that early growth spurt, pregnant folks, people that gain too much weight too quickly. Another group of people are your older people, usually bodybuilders, 30, 40, 50 years old, that start using steroids. And then they have that growth, and that happens. Somebody's been small stature their whole life, and then about 40, 50, you start noticing those stretch marks, and they're getting big quick. That sometimes can be
a sign of steroid use.
It can be.
Well, that'll kill you eventually, or drive you crazy. There's a lot of things that stem from steroids.
Or cause you have that heart surgery.
That's another show, I guess.
Like Arnold had to have, Arnold Schwarzenegger. Yeah. He had to have, his heart had grown so large, his valves weren't even working anymore.
Well, how did they fix it?
They had to put new valves in. His heart got so large, the valves moved apart, and they weren't working.
So they put a new.
They had to put new valves.
In his heart. They didn't actually give him a complete heart transplant. They just went in there and put
new valves.
Artificial valves in there. Yeah. I didn't know that. I didn't know they did that.
Because the muscle grew, but the valves did not.
Yeah. Well, that makes. And he'll be back.
Yeah.
All right, Tony. We got to take a little break. We'll be right back.
Magnolia State Family Medicine, Health Center and Medical Spa, 1009B City Avenue North, Ripley, 587-8176. Call for your appointment. Providing modern medicine with Southern hospitality. That's Magnolia State Family Medicine, 100% veteran-owned and operated. Bethel University Physician Assistant Program affiliated. Magnolia State Family Medicine. Dr. Christopher J. M. Cummins, Medical Doctor. Fast, hot, and fresh. Open 24 hours just for you. Dodge's Store. Come be our guest. Dodge's Store, Ripley. We are 100% employee-owned with friendly service and a fun atmosphere. High quality, low prices. We are Food Giant. Our deli serving breakfast, lunch, supper. Food Giant, 702 Highway 15 North, Ripley. Come shop Food Giant. Want fresh meat and fresh produce? Food Giant's the place. High quality, low prices. Food Giant.
We're back. This is the Ask Dr. Cummins Show. 587-8176. Give it a call. Ask your questions. All right, Doc, I got another grandmother that called. Said a great-granddaughter has been diagnosed with, never heard this one, chromosome 14. It is rare. She's asking, what does it cause? Does it mentally slow you down, or does it add or take away from your appearance? What is chromosome 14? Now, I hit you with that cold turkey. You probably, I don't know, I'm sure you probably heard of it, I guess. Do you, am I hitting a button there that rings a bell?
You are. That takes me back to biochemistry, and some. It is a rare genetic disorder. It's along the lines that, it's more rare even than Down syndrome, but it is a genetic chromosomal abnormality, like she's talking about. I want to say it's called Edwards syndrome. I'll have to clarify that, but in most instances, all of those chromosomal abnormalities, if you do survive, if the fetus survives, the baby survives and into birth, they usually do have a shorter life expectancy.
Well, no, she didn't give me that kind of information. She just said that has been diagnosed with chromosome 14. And the question was, is it rare? What does it cause? Or do you mentally, does it affect your mentality? Does it affect your appearance? Those are the type of questions. But I didn't get the information. Right. But the baby was the granddaughter, a great-granddaughter, so the baby is living.
Okay. So again, I would be prepared for a shorter life expectancy. Most instances, the mental status is not on an average level. There will be most likely some degree of mental retardation. There are, and oftentimes, but not every instance, there is some phenotypic or facial differences in those children, or in their body shape or habitus. I feel for the family, and y'all certainly have my sympathies on that. That's a serious disease. The good thing about today, we do know a lot more about even those rare genetic abnormalities, and with proper care and stuff, there can be there's a lot more we can do for those kids today than there was in the past.
That's right.
And I would encourage you to work with your doctor. He can get you to a specialist, probably like in Labana or something.
And then North Mississippi, there's a North Mississippi Mental Retardation Center in Oxford that branches off of Ole Miss. That's pretty highbrow place to take.
It is.
Something wrong with.
So there's a lot of support. I guess that's what I'm getting at. There's a lot of support out there available for you and your family, and y'all need to use that, and to make sure you take really good care of this child and give it the best that's out there for.
Well, you know, those are special people that have children like that.
Yeah.
They're special people, and I'm sure they, you know, we wish you all the luck with that. And I don't know. I assume the baby or the grandchild's still living. I didn't get that kind of information. This was just kind of a deal. But anyway, you had mentioned National Alzheimer's Month, or they're going to celebrate that in November, right?
That's correct.
I pulled out some things from an article that I was reading, and I'll hit a couple of them. Smoking just causes everything, doesn't it?
Well, sure
they just lay everything on smoking. One of the main things to stop or to help not get Alzheimer's is that smoking after the age of 65 makes a person almost 80% more likely to develop Alzheimer's. So stop smoking and greatly reduce alcohol intake is one of these things. Avoid activities that can lead to head injuries. Diabetics are twice as likely to get the disease. One thing that interested me, about a year ago, they said it could go down to age 45, but it says here it can start as early as when a person is in his or her 20s. It can go back, and the onset of Alzheimer's can start when you're in your 20s. So, Alzheimer's is a very, very, not only is it bad, it's a sad disease. Yeah. You're actually sitting there with your mom and your daddy, and that's most of the time who you are affected by, or maybe your brother and sister. And you're sitting there, and a person that either raised you or you grew up with just totally don't know you anymore. That's what Alzheimer's does, isn't it?
It's one of the hardest diseases for the caregiver. The person who has a dementia, for the most part, they're not bothered by it.
They just don't know.
There are rare cases where they'll have a lot of crying spells, but it's really hard for the caregiver, and it's important that the caregiver, again, like the chromosome abnormality we discussed, that these caregivers need to have, there's a lot of supports out there for them, and they need to make use of that. Talk to your doctor about it, because you can have some burnout real quick, and then which can lead to abuse of your loved one because you get frustrated or things like that, or neglect and things. We don't want those things to happen.
You know, they can sit there and make you mad by saying something and they don't even know what they're saying.
They have no idea.
And another question along, we mentioned last week about our 3 nursing homes. Is there a large percentage of people in the nursing home with Alzheimer's?
A lot of people either have dementia, Alzheimer's type, or senile dementia, which is just a dementia that's really, it's kind of one of those diagnoses. They don't know what else is causing it, so they call it senile dementia. Then there's Lewy body dementia. There's a spectrum of dementias out there. So a lot of hospital patients do have, nursing home patients do have dementia of some sort.
And you mentioned caregivers. That's probably the route a lot of people go, is in a nursing home for somebody like that, right?
Eventually, a lot of times the child will try to take care of them his or herself, and when they have children of their own or other needs, a job, all this kind of thing, these patients end up requiring 24/7
It's overwhelming.
Care. It is.
On the family.
It's a hard one, and that's another one. Y'all have got my sympathy on that one too. It is.
We got about 2 minutes left. You want to hit anything at the hospital or at the nursing homes or at your office since we can go in? We got about a minute and a half left.
Just please announce it. If you do come to my clinic, you will start seeing some students, medical assistant students from Delta Technical Institute that trains medical assistants, and they'll be coming and being with us, so we hope you'll be open to them so they can learn and put them to work.
And then that's different from the PA that we talked with last week.
That's correct. And these are more geared up to help the nurses.
Okay.
So it's a really exciting time with that.
Mainly females?
Mainly, but not limited to.
Not limited to.
That's correct. And there needs to be more males in the healthcare industry on all levels because of the, you need a little more muscle sometimes picking these patients up and need some help.
That's right.
But that's all. That's the latest that we have going on in the clinic, and I'm out in the town right now.
All righty. We certainly appreciate y'all tuning in to this evening. Once again, the phone number is 587-8176. Give it a call. Ask your questions. Not too big, too small. Not too smart, too dumb. Whatever. Just call in. Complete privacy with your question. We'd appreciate hearing from you. Good night.
State Family Medicine, Health Center and Medical Spa, 1009B City Avenue North, Ripley, 587-8176. Call for your appointment. Providing modern medicine with Southern hospitality. That's Magnolia State Family Medicine, 100% veteran-owned and operated. Bethel University Physician Assistant Program affiliated. Magnolia State Family Medicine. Dr. Christopher J.M. Cummins, Medical Doctor. Fast, hot, and fresh. Open 24 hours just for you. Dodge's Store. Come be our guest. Dodge's Store, Ripley. We are 100% employee-owned with friendly service and a fun atmosphere. High quality, low prices. We are Food Giant. Our deli serving breakfast, lunch, supper. Food Giant, 702 Highway 15 North, Ripley. Come shop Food Giant. Want fresh meat and fresh produce? Food Giant's the place. High quality, low prices. Food Giant.